Hi, and thank you for joining us today for our latest in the professional development series presented by the Delta Omega Honorary Society in Public Health. Founded in 1924, Delta Omega is now 100 years old, and we have over 130 chapters with more than 30,000 members. Just a couple of points of business before I introduce today's presenter. Please feel free to use the chat to talk to each other and about the presentation. But if you have any questions you'd like answered by the presenter, please place those in the Q&A section, which you'll see at the bottom of the screen so we don't miss it. And this is not the last presentation in this series, so don't forget to visit the professional development section on deltaomega.org to see older recordings and to sign up for future webinars. That said, let me introduce today's presenter. Today we have Dr. Apryl Alexander, who is the Metrolina Distinguished Scholar in Health and Public Policy and an Associate Professor in the Department of Health Management and Policy at UNC Charlotte, where Delta Omega has our Beta Phi chapter. She is also the Director of the UNC Charlotte Violence Prevention Center. She received her doctorate in clinical psychology from the Florida Institute of Technology with concentrations in forensic psychology and child and family therapy. Dr. Alexander's research and clinical work focus on violence and victimization, human sexuality, and trauma-informed and culturally informed practice. She's an actively engaged public scholar and has been interviewed by numerous media outlets about her research and advocacy work, including the New York Times, Essence, USA Today, and NBC Nightly News. Now, let me just hand this over to Dr. Alexander.
Thank you, Jillian. Transition the slides. All right. Well, thank you, everybody, for coming to this session of this series. I'm really glad to be here, especially as a new Delta Omega member. Going to spend some time today talking about public health advocacy. I know a lot of you are probably joining today because you have an even more increased interest in advocacy during this time. Advocacy isn't foreign to public health by any means, but I know there's a lot on our plates right now. And I know for students to early career professionals to folks in the field wondering how they can get better engaged in advocacy efforts for public health. And when I say right now, we have a lot on our radar. Again, we're having a lot of conversations on public health and its place in our different federal agencies. Thinking about at the state level, how are we centering public health and its efforts in our work? Whether it's the continuing conversation about vaccinations to overall health and well-being, nutrition issues, we are all dedicated to really thinking about how we better engage in this work.
Dr. Alexander, there's a little pop-up in the middle of your screen. I figure you want that.
Oh, is it on the
other one? Continue to share. Yeah.
Yeah. Thank you. That's new.
I didn't see it before either.
And so we're all trying to figure out in each of these domains that we're really interested in, how can we best amplify the work that we do, educate the public on the issues that are so near and dear to our hearts and to the well-being of community, and also amplify our work to key decision makers, whether that's administrators in hospitals and local public health authorities, or to our legislators who pass important laws about our work that affect community well-being. When we talk about what's on our radar, we know we've been having a lot of conversations at the local, federal, national, even global level about issues related to access to care. Here in the United States, we're seeing changes with the Department of Health and Human Services and how it's structured, and even some of its legislative priorities. A lot of us are concerned about the potential proposed Medicaid cuts and the impact that that might have on individuals, families, and communities. And then continued conversations about gender affirming care as we've seen various legislation change in the last several years, of thinking about how do we continue to get gender affirmative work to especially youth and families who are in need of it. Further, with many of the global crises that are coming along, we're thinking about the health and well-being of immigrant and migrant children and families, really kind of thinking about the impacts of familial separation and deportation on those individuals and families. We've seen that across the country, it's even impacting school attendance. I was recently in a meeting where they asked somebody in law enforcement, do we have to worry about graduation? Is this a place where we might encounter some incidents where families are being separated? And so really kind of thinking about the impact of health and well-being of children and families. And then there's so much more. Each of you came to this session today because there's some kind of niche area that you're interested in. And so really kind of thinking about how does this all intersect with human rights and thinking about violation of that. Some of you are invested in global policy and global relations. So really thinking about how we can best advocate for some better synergies in that space. All of these issues are affecting public health practice. So for each and every one of us in each of our roles, really thinking about where are the best places that we can advocate. For some of us, we have to think about where do we sit in this as a field, as a profession, as Delta Omega, on what are our public health priorities at this time. There is so much going on, and I know that can be overwhelming for folks. A lot of people ask me, where do I tap in? Or I have all these different interest areas. And so really kind of thinking about what is key to you as a person and to your work at this time, and really kind of thinking about what those priorities might be. With the American Public Health Association, they have listed their advocacy priorities. This is on their website. Each and every year, you can see what APHA is doing in terms of advocacy priorities and really being a placeholder for what we're doing in the field. So one, yes, we want to protect the key public health agencies and maintain our national public health infrastructure, really recognizing how important it's been over the decades in the protection of health and well-being of all folks. That also includes really thinking about our workforce. How are we creating the next generation of public health professionals, especially since we saw that decline that happened around the COVID-19 pandemic back in 2020, 2021. Obviously, US-centric, thinking about the Affordable Care Act and how do we strengthen and expand some of its capabilities. Issues related to the health impacts of climate change being on there. And then obviously at the bottom, thinking about reproductive health and well-being. And just thinking about how do we uphold and strengthen public health laws, and again, our positionality in public health at the legal and federal court level. We know that we've recognized the gun violence epidemic, so that's obviously on our public health priorities, thinking about all the laws and pieces that come into play with reducing gun violence. And then the APHA talked about a ceasefire and call for that, and really kind of thinking about humanitarian aid in order to help support those most vulnerable. Well, not on the list of their top priorities, they do talk about issues that we need to continue to monitor, maybe some ones that we still need to have community conversations about in order to think about best processes for how to proceed with them. So really kind of thinking about reauthorizing the Pandemic and Preparedness Act in order to help support our local communities after natural disasters. There's been continued conversations about supporting the FDA prohibition on the sale of menthol cigarettes. In fact, here in North Carolina right now, they're having these conversations right now, including North Carolina being one of the few states that hasn't raised the age for cigarette purchases to 21 just yet. So that's in the legislature as we speak. The protection for our farmers and thinking about nutrition security and really thinking about the impact that some of the current legislation is having on our farmers. And that trickles down to nutrition standards to children as well. And so each of these is what our national organizations are identifying as maybe some of the key priorities in the field. Again, we can't be all inclusive of all the multitude of priorities. And so this is where each and every one of us needs to think about what are our personal and professional priority areas, and where do we start to tap into advocacy. I recognize I keep using the term advocacy, but maybe we don't know how that's always defined. In fact, in my field of psychology, I talk about advocacy a lot to professionals in psychology, and some of them are hesitant to engage because they say, "Ooh, I don't want to march out in the streets." That's not the only form of advocacy that exists. And so for us to kind of think about advocacy in a way that we're amplifying kind of our work in our fields and doing so in a way that is informative or persuasive. And so that's what's caused the tension over time is advocacy is often ill-defined and leads to some confusion or tension or just some uncertainty about what our roles as professionals should be. I really like the scoping review that was written by Cohen and Marshall in 2017 that talked about varied definitions of advocacy. Maybe it is championing for a particular cause, issue, idea, or policy that promotes health and well-being, either with or on behalf of a particular population that you're working with. This also means strengthening the capacity of community members in order to benefit or improve their health. So all of the great work that we do in health education is also advocacy. Thinking about actions that decrease structural barriers to health, again, health equity being the center of so much of our work, and so that being an important part of advocacy as well. And then using the media to advance public policy initiatives that promote population health. So think of all of those really important media campaigns that you've seen that have been informative, persuasive, or just created some conversation about an important public health issue in your community. That is also advocacy. So advocacy could take many different shapes and forms of really kind of thinking about various approaches through our socio-ecological model that we are amplifying issues in order to change policies, change practices, in order to influence individual and population health and well-being for individuals. For us, we're also trying to solve what's often been called these wicked problems. So really thinking about these social, cultural, or institutional problems that are difficult to solve, the ones that are complex or persistent. So part of advocacy is also thinking about how are we organizing community to have conversations on how do we address these wicked problems. If we're talking about gun violence, where is there a way to have conversations about community safety and protection where everybody feels heard and welcomed in this conversation, and we can get to the point of resolution of the problem? Now, there have been existing barriers to advocacy engagement. I always start here with my health policy students and talking about what are their concerns about advocacy engagement. And they often lie in these three core areas. One, disinterested. I typically don't know those people. Obviously, they're not the people in the room because you're here, but it's those who might not have an interest in participating in public policy or advocacy engagement. They don't see a need for it. But the one that I'm most concerned about is a lot of people believing that their participation won't generate an effect. Again, change takes time. So sometimes people give up or become disinterested because they just don't believe that their voice will have an impact on this work. Or for some people, poor past experiences. I've talked to colleagues who said, yep, I went to the Capitol. It was a terrifying experience. The bill didn't get passed. And I said, no more, don't want to do any of that again. So really getting us past that point of really kind of thinking about, again, change takes time. It can be incremental, and really thinking about how do we bolster the skills in our professionals to be able to do this more effectively. Next area is uncertainty. This is the bubble where I see most students and early career professionals and others in the community of just not having enough knowledge about how to engage in advocacy. So you might be really passionate about an issue, but you don't know who to go to for help, or who will listen to you, or who the decision makers are. Also, you might not feel you're persuasive enough. So I often get this anxiety from folks of, I don't know if I'm smart enough. I don't know if I can engage enough. And we'll kind of talk about that in some of the examples later of you have the knowledge, you have the skills, and you have the lived experience to be able to offer that to key decision makers. And then unawareness. So thinking about lack of awareness of public advocacy issues. In each and every one of my classes, I'm sure some of my students might get sick of it, I start the class off with relevant news articles that are relevant to the course. So if I'm teaching a course in health policy, what are some of the key things that are happening right now in terms of health policy to build that awareness? Sometimes there are laws that are being passed that we had no clue that were even being considered right now. Decisions are being made for us, but not with us. So thinking about how do we build those awareness of issues that are happening in our communities so we can know where to tap in with our advocacy. Some of this can also be witnessing what you're seeing in the field. So as you are working in different public health agencies and organizations, what are you experiencing? What are community members saying? And really leaning on that of being the center of maybe what those advocacy priorities for you or your agency might be. So I do want to talk about some approaches to advocacy. I put public health advocacy here, but a lot of advocacy work has to be multidisciplinary. We don't do this in silos. So again, my background and training is as a psychologist, but I often work with public health professionals, social workers, educators, lawyers, and people in community that don't have some of these professional titles in order to do this work. We each come from this in different lenses, and so there's different ways to approach the problem. And so all of these approaches are kind of key and essential to doing this work. What I first want to think about is who is our audience? So there's a key issue that you have in mind that you want to advocate for. Who do you want to talk to about it? Who are the people that you might want to reach? Thinking about, is this legislators? Is this the administrators at my particular hospital that I want to talk to about on the ground issues that are happening right now? Is it people in community that I just need to do better education on maybe some of the ill effects of some type of environmental cause? So really nailing down who are the people that I want to speak to. And then for us, thinking about what is our message? What is the one thing we want to get across to them in order to be informative or persuasive? So really kind of condensing down to what are some of the key takeaways from our work that we want to communicate to this audience. Where's the best place for the message? Is it us doing some community outreach efforts and community organizing? So going to libraries, going to community centers in order to do some educational work? Is it going to the media of highlighting maybe some new efforts that you're having at your organization that are having a broader impact that we need to be invested in? So really kind of thinking about how we want to use that lens. I have media on there once again of just thinking about how are we using social media and media to be informative and talk about and amplify a particular advocacy issue. And then why do our followers want to hear from us? I think we keep talking about these issues right now of misinformation and disinformation and who we can go to for trusted resources. Again, I hope it's us. I hope it's us professionals that they can come to and rely on for the key messaging in order to counter some of this information that is misconstrued in media. So really kind of thinking about how do we deliver that to the audiences that we want with integrity, with ethics in place, so followers can continue to listen to us and be influenced by us. So one of these first areas of advocacy is really kind of thinking about legislative advocacy. So whether it's your expertise or your research or just your lived experience in the field, how do we get that in front of policymakers? So policymakers are out there building these laws, building these different policies in our fields that have impact on us. How do we talk to them about best practices? How do we talk to them about our research on key areas? So these are just two examples of my advocacy engagement over the years. The first one is me testifying on a bill that would ban mental health practitioners from using conversion therapy on youth. And for those that don't know, conversion therapy is the unfounded and unethical practice of trying to change a person's gender identity or sexual orientation. But there were mental health practitioners who were still using it in the state of Colorado. So for me to go there and use my expertise on this isn't something that we train in, the field believes it's unethical. I can cite different resolutions from the American Medical Association, from the American Psychological Association that support that we shouldn't be using these practices. And so being able to communicate that to our legislators. The other one is the Crown Act, which many of you have seen in various states or even cities, is introduced in California to end hair discrimination. We know that people are discriminated from the workforce and their school settings for how they wear their hair. And we know that's an issue of equity because it often impacts racially minoritized individuals. So being able to go there and talk about the impacts that discrimination has on individuals and why this bill should be passed into law. And again, we were successfully able to do that in Colorado in 2019, and it spread to other states. So legislative advocacy is, yes, let's go to the key decision makers. In legislative testimony, I often teach my students, it's really, I won't say easy, but seems easier than some of the stuff that we do in classes. 3 minutes to say your piece on a particular bill. My class presentations are 10 minutes, 15 minutes. So 3 minutes to talk to a legislator about the key issues of your research, lived experience, and why they should support or oppose a particular bill based off of our expertise. And so legislative advocacy can fall on so many different levels. Again, that work was at the state level, but really thinking about, are you tapped into your city council and the decisions that they make? Do you know your mayor? Maybe this is an issue we need to take to the governor, to Congress. So really thinking about how do you inform yourself on civics, and thinking about civics literacy, in order to kind of think about all of those individuals that we should contact if we were trying to pass a policy. For people, again, in the United States, just kind of thinking about who is your local legislator, who represents you. So you can often go to your legislative website, your General Assembly website, type in your zip code, and you can see who represents you. So if there is an issue happening in community, have you taken the time to email that person to alert them to a particular issue? Which goes to my next slide of what do we do in terms of legislative advocacy? We show up. So again, making ourselves present in these different spaces. So have you attended a city council meeting? A lot of them are virtual now, so I can attend from the privacy of my own home instead of having to go downtown, face traffic, and things like that. Again, you can write your legislators. They're supposed to represent you and your interests. And so I think for us as public health professionals, it's even more important because we have some key, again, research and expertise that we can help to inform this particular person of our position on the issue or our opinion. And then I say, keep showing up, keep writing, that we need to think about how do we show up in these spaces, because if we're not there, then who's there? The misinformation might continue to be spread. So thinking about how do we show up, and again, what issues are most pressing to you? Each state has hundreds, if not thousands, of bills that get introduced every legislative cycle. We can't be there for all of them. So what are some of the key issues that we can focus on? Let's look at those legislative committees, again, on the General Assembly websites, and then find out what are the ones that are affecting us during the legislative session. Also, there might be an opportunity to network with different decision makers in order to create new bills. Again, some of the Crown Act wasn't new. It was taken from California, and other states have replicated it. And so maybe there's other kind of policies that are out there that aren't in your current state or jurisdiction. And so thinking about how you can bring that to some of the legislators that represent you or others that are on respective committees that represent public health. And so again, taking the time to make those connections are helpful. I've gotten to know a number of different legislators over time. The top one with me and my dog from several years ago was a legislator that I met during the testimony on the ban on conversion therapy, Representative Breonna Tattone. When COVID-19 came around, she wanted to hold a forum on what are the mental health consequences for individuals during COVID-19. What are some things that we should be thinking about as legislators? And where should we be putting funding at this time? And so she invited me to this Zoom webinar during COVID in order to have that conversation with other public health and mental health professionals in order to talk about the potential consequences of COVID. And again, they were able to take that back to their committees and create relevant policies to help during that time. That we have to remember there is health in all policies. So once again, this is a framework to think about how public health has an impact on policymaking and really thinking about the different sectors that policymaking can occur. Yes, I was talking about state and local government, but policy also affects different organizations and agencies and nonprofits as well. So our goal is to really think about how are we informing decision makers about issues related to health, health equity, access, and even sustainability by providing our research, our expertise in order to create data-driven policies. And some of the key elements, if you're unfamiliar, is again, thinking about promoting health, equity, and sustainability, like I said earlier. Again, that support of intersectoral collaboration. We can't do this in silos, so how do we come together as different professions, as different organizations and agencies to do this work? We benefit from multiple partners. We benefit from having all folks at the table, because this can help create synergies. This can help us connect with community and be more powerful when it comes to engaging in policy work. And then over time, those relationships can create structural or process change. That when we come together as an alliance or as a coalition, it might be for one time, but those relationships, if they go well, might sustain over time in order to come together for other issues that we want to cover and address. So I love this framework because this gives us a starting point of thinking about how do we get involved and engaged in policy work by amplifying what we're already doing. Another aspect is engaging in media advocacy. Again, for some people, this might be a little bit scary, but I hope to offer maybe some different options. What media advocacy does is it thinks about how do we create a strategy for delivering our message. So back to that, who is your audience? I often go through those key points with individuals as they're preparing to engage in media in different ways to really think about delivering the most powerful and persuasive, informative message that they can. You also have to have an understanding of various media outlets. So again, if we're thinking about social media advocacy, things are changing very rapidly. Different populations really like Facebook. Other populations are gravitating towards Blue Sky. We know Gen Alpha loves TikTok and Instagram. So really kind of thinking about where do we want to deliver our message in order to have an impact for our intended audiences. And then having an awareness of which media tools best suit the strategy. That maybe we need to be really verbose in our message. And so maybe we'll look for a long form podcast that can give us kind of that space and energy to talk about our message in a more detailed and thoughtful way. With a broader audience versus a TV interview, which will get maybe squished down to 20 seconds of airtime. So really kind of thinking about which tools satisfy and meet your needs. And thinking about how do you connect with local media. So if it's a very much a local issue that you're describing, really thinking about connecting with contacts. One of the things I do is I follow some of the people that I watch on TV on social media and really kind of get to know them in order to kind of think about how I can leverage that in the future when there is a key issue I do want to bring to media. One form I just want to talk about today, because I know this could be a whole nother talk, is op-ed writing. We're starting to see more folks in public health write op-eds. Op-ed stands for either opinion editorial or opposite the editor, that's been shaped over time, which was created in newspapers to have a space for community members to talk about key issues that are happening at the local or national level. Op-eds are important because, again, they can be educational. So thinking about how we can inform people about a timely topic that is the center of media right now, or they can be helpful in shaping public opinion. If we think of all the people who read papers, even whether they're physical or digital, important stakeholders, important decision makers might be reading it. And so that's helpful in getting out our message. This also gives you the opportunity to tell a story. I love reading op-eds because people often integrate, again, lived experiences or experiences that they've had in the field in order to tell the story on why this particular issue is important. And most importantly, especially as I talk to students about op-ed writing, they're short. So most op-eds range from anywhere from 500 to 750 words. If you're looking at outlets like The Atlantic or other blogs, they're much longer, but a typical op-ed in a paper is often 500 to 750 words. So really kind of thinking about, one, this is a short message, so let's condense it down to this short space. But I think for a lot of people, it makes it a little bit more accessible that it is that short. I've been teaching op-ed writings in classes. So again, very accessible to our public health students and faculty and that I'm working with. This is something that we can integrate into our practice. So in my health policy and leadership class, we have to write not we, but my students have to write a policy analysis on a topic of their choice, some key or important public health issue that is happening right now. Many of them are doing research in other areas on that particular topic. So they write their policy analysis, which is very much formal, very much structured. We know our intended audience is often decision makers or policy makers. So after we write it, I then want you to take all of that information and craft it in an op-ed, because that's going to be a little bit different. An op-ed, again, if a person's picking up a newspaper, this has to be written in a more accessible manner. We can't always be using jargon. We can't use our fancy acronyms. And so learning that skill of how to deliver our message to various audiences is part of this course. And so they write their op-eds, they do a good job. And again, some of our students have gotten these op-eds published. In fact, you get extra credit if you're able to get it published during the time of my course. of really thinking about, again, key issues that are affecting our community and getting it out to audiences that are able to make decisions or just, again, think about shaping their opinion on a particular topic. And so Michelle was advocating at the school board of her children's school, and she's a former teacher. And so it was really important for her to talk about teacher pay during this time when there was a big conversation here in Charlotte on that topic. So this was something she was going to talk to the school board about anyway. And so being able to reach a broader audience by delivering it there. Then again, with social media, just kind of thinking about the benefits of it. It's part advocacy, but it's also, we get to engage in professional networking. So seeing other public health professionals on social media is really important for, again, delivering accurate information out, and then also getting connected to others in the field who are doing similar work. We can share media, so we can share videos, we can share our articles, we can share the latest projects that are happening at your agency via social media to get the word out and, again, be informative. It gives us a space for content production and knowledge production in order to kind of disseminate in a way that reaches a lot of people. Then another form of advocacy is just thinking about community organizing. So community organizing has always been the bedrock of advocacy efforts because we know the importance of people power. So thinking about how do we organize community members and mobilize them and sharing their lived experience, sharing their expertise in order to create change. We're going to do that in collaboration. So thinking about, again, the importance of multidisciplinary or collaborative work in this. And it has a frame of social justice, again, in just trying to eliminate inequities, empower imbalances that are occurring in our communities. And so the goal of this is really to empower communities to be engaged in the change that they want to see. So that might be doing leadership development with them, doing civics education, because like us, our community members often don't know who to go to voice their opinion. So what if we gave them trainings on how to deliver legislative testimony to their city council in order to see that change? And then community organizing also could be mutual aid efforts. As we're seeing various budget cuts, we're worried about how are we going to get the needs met of community. So can we do that from different ways, whether it's foundation funding or, again, private donations? So really thinking about how are we getting connected to the community at that level and making sure that we're centering their voice in all that we do. Then one of our last key components is for any of the researchers or budding researchers in the audience. Over the years, we've had a lot of criticism about our research not being accessible to the community. So the goal of our research, often as academics, is to get it published in peer-reviewed journal articles. Again, thinking about what that looks like. One, our peer-reviewed journal articles are often written with a lot of jargon in it, a lot of high-level stats that many people in the community aren't familiar with. And then if you wanted to download any one of my journal articles right now, you're probably going to be hit with a paywall. And so do you have access to even read my journal article? So there's been a lot of criticism behind this because, one, the public funds our research, our tax dollars go to funding research, and we're not giving it back to them. There are participants in the research, and we're not giving it back. So there's been a call to action on how do we make our research more accessible to the community. One model for this is, again, thinking about this public impact scholarship. Other fields have talked about this more intensely. This article is by a group of my former colleagues who are at the University of Denver in their social work department, of really thinking about how do we get our research out to the public and to have a greater impact. Even with our journal articles, who's reading it? Our fellow colleagues, not the public. So thinking about new and innovative ways for dissemination. So yes, I talked about media advocacy a little bit before, but thinking about, can we build websites? I'm seeing my colleagues develop zines, these mini magazines, public reports, developing YouTube videos, and even giving TED Talks. All of those having broader impact beyond maybe some of our academic research outlets right now. So really getting creative and innovative on how do we want to disseminate our work. My life has changed as I've invested in this. So being able to take the opportunity to talk about my own work, again, being at the intersection of psychology and the legal system, I've worked with youth who are systems involved. I've worked with survivors of interpersonal violence. So being able to get some of the messages out about public safety and my research out to a broader audience than I could even imagine. After I did my TED Talk, it was weeks of having coffee dates with community members to talk about my message in my TED Talk, to talk about my research, and think about areas for change. That shortly thereafter, I was able to testify on a bill that would allow for comprehensive sex education in our community. So really kind of thinking strategically about how do we get our research out there in order to use it for change. And me and my research team, we've responded to a bunch of timely topics over the years of thinking about, one, the effects of COVID-19 on various populations. My students were working in jails and carceral settings during that time where there was little PPE, and we were worried about the most vulnerable in those settings. Also thinking, again, like I said earlier, thinking about the impact of COVID-19 on domestic survivors, domestic violence survivors, and getting access to care during that time. And so really thinking about at times of crisis, how do we either pivot our research or amplify our research in ways to create change? One of those examples is my research team. We saw the murder of Ahmaud Arbery in Georgia. And we're really impacted by what we were seeing with that case. So the individuals who chased him down while he was jogging in his own neighborhood and murdered him, there was debates on whether or not they were going to introduce stand your ground laws. Stand your ground laws were created for the kind of purposes of if there was an imminent threat, you can use lethal force by gun or other object on a person who was assaulting you. And so we had a lot of questions about that, and we ended up creating a research project centered on that of, are people aware of these laws? Do they believe that they're fairly applied? And we wrote an article about that, again, based off of this timely case. We published it, and then a week later, we had yet another case, just a week or so after it was published, of Ralph Yarl, the 14-year-old boy who knocked on the wrong door, trying to pick up his siblings, and a man shot him through the door and harmed him. And so again, they were having a debate on whether castle doctrine or stand your ground laws applied to this case. So really kind of thinking about the importance of our timely work in order to advocate for better policy and practice, or just inform the community of some of the issues that are going on in our work. I want to end with talking about roadblocks to advocacy engagement. Earlier, we talked about maybe some of the reasons why people don't want to engage in advocacy. I hope we get outside of that, that you're thinking about how you can engage and how you can get connected to your community in order to foster change. But I want to be realistic that there are roadblocks in this work that make it difficult. That doesn't say we should give up, but it's just more of an acknowledgement of these roadblocks. So one, we know there's institutional and climate barriers that are happening right now. So maybe there's some limitations for our faculty on what they're able to teach or not. If we're looking at the institutional level, we know there's laws and policies impacting our work. So whether it's impacts on being able to deliver gender affirming care or deliver anything that sounds DEI in nature, we know that's happening at this time. So it's important for us to have these conversations, to think about how can we do this work that is still important in the foundation of public health, while still abiding by these policies as they come, while still being an effective advocate for change based off of what we know in our profession. We know there's student barriers as well. I get a lot of questions for students that are saying, I'm just a student, who's going to listen to me? And I often say back to them, if we look at any kind of civil rights movement throughout, not just the United States, but the globe, often young people and or students were involved in those efforts. So it's never too early to get involved in advocacy efforts. There have been great articles about this and kind of thinking about what student leadership in public health could look like. Thinking about all the organizations like a Delta Omega that give you the space and platform to engage in this work. And then thinking about that at the university level, we do have a bunch of challenges coming our way. So thinking about how do we help our students during these times and being able to advocate for them to even be in our universities and campuses in order to be the next generation of public health professionals. Similar to institutional barriers and climates, we know that there's legislative changes. So many of us who rely on state and federal grants or contracts to do our work know that some of our key priority areas that are related to public health are dwindling in terms of funding. We know that grants have been terminated. My own team at the UNC Charlotte Violence Prevention Center has been impacted by this. So again, this is going to be one of the roadblocks in some of our advocacy efforts. Again, just a roadblock. Some of this is not new. If we look at across different generations, there have been roadblocks and barriers. It just changes kind of how we do our work. And yeah, it is impacting maybe some of the jobs that people are having. I talked to a team today where several people that we worked with over the last 2 years had been terminated. So really kind of thinking about how do we stand up for public health, particularly during this time where we're seeing public health issues being cut. Also knowing if we engage in advocacy efforts, there are risks in allyship. So if we think about allyship, it's often advocating with or on behalf of a marginalized community, one that we're often not a part of. So we've talked over the last few years about the importance of allyship. So being able to step up to the plate and do this advocacy work that is hopefully selfless. But we know that there's risk in that. And so we have to acknowledge that and think about how are we sitting with those risks and engaging in brave spaces. And the last challenge is self-care. So how do we do this work and not get burnt out? So we have to also recognize that advocacy is supposed to be a collective effort. I think I said that in different ways when I talked about multidisciplinary, but really collective, that we're coming together and doing this community organizing to show a collective front. We're supposed to be a true community together. So how are we protecting ourselves at this time? There are times that we need to step back and step away because it is a lot. There are times where we do have to turn off the news on occasion. So I told you to be informed earlier, but then at times it is too much. I don't want you to tune out, but there are times that we need to take a break in order to protect ourselves. We can't be effective advocates if we're not here. We can't be effective advocates if we're not doing well. So just thinking about how do we protect ourselves from that fatigue, from that burnout. And again, people from marginalized identities or historically excluded communities often face this fatigue and burnout disproportionately more than others. Never want to leave on the doom and gloom with that. So I just want to leave you with, before we hop to questions, just the notion of radical hope, which has come from so many different of my colleagues who practice liberation or are engaging in radical hope interventions within the mental health field. Of what keeps me going in this work and what makes me continue to do advocacy work is hope. We might be in times where we feel burdened, where we feel burnt out, where we feel like things aren't changing. But I hold on to hope because we have seen different times in our history where advocates have created longstanding change that has influenced the work that I do today and has enabled me to even be in the position I am in today. So for me, I still have to hold on to this notion of radical hope in order to continue doing our work. Again, just wanting to show an article if you want to read more on this, that this is a framework that we can incorporate into some of our interventions and just even through some of our philosophy on how we approach community, of really kind of thinking about how do we empower individuals to stand up at this time, to engage in advocacy, and just be there for their communities during this time. So I always like to leave some minutes left. So again, I want to thank Delta Omega at large for having me in this space to talk about this. We could go all day with advocacy. So some of this is just kind of a starting point. I hope you're going back to your various institutions and continuing these conversations about how you want to move forward certain messages and how you want to get engaged in your communities.
Great. I do have some questions coming in. First is from Rebecca. How do you recommend early career professionals get established or involved with advocacy? In other words, how do you go about having your voice heard?
Yeah, one, that's where kind of start with the show up. So how are you showing up to spaces and engaging with individuals in your community who can get to know you? So I just sometimes even go to community events and forums. I think we have one next week where, fortunately, somebody invited us. It's on gun violence and the impact of mass shootings, a local organization. Yeah, I'm going to show up, not with any intention or anything. If something comes from it, fine, but I just want to show up and support. And then also thinking about, could you reach out to other communities and individuals and organizations? So, hey, I did this cool article on nutrition. I was wondering if the food bank wants to see the results, if I can write a one-pager that you'd be interested in, or can I come talk to you? And again, some of it evolves from there.
Great. And then in terms of advocacy, can you speak to the importance of involvement in local city councils and state legislators versus federal government?
Yeah, we need policy in all levels. So why I talk so much about the local level is because one, I'm a distance from DC, like a lot of us are. So we don't always we often talk about federal government and all of that. Yes, it's important, but there's a lot that's happening in our state and local levels. So we need to do both. So I continue my professional organization, send out action alerts that go to our federal Congress members. I fill those out. I sometimes make contact with them, but I like a lot of the local level work because, again, that's the work that's affecting kind of my immediate community and seems a little bit more tangible. It's a little different here. It's about 2 hours away, the Capitol, but when I was in Denver, the Capitol was 10 minutes away from my house. So I was in there all the time. So people knew me. Even when I'd walk into a legislative session, some people would roll their eyes. I was like, I'm not even testifying today. I just wanted to see what issues were coming up. I wanted to learn more about this particular issue. But having that visibility and starting to become more informed. When I moved to a new city, or I almost moved to a suburb here, I read some of the city council minutes for the last year. Yes, I'm a nerd, but I wanted to know what was going on in that community. What were some of the key issues? So you get to see all the cool stuff on why certain parks weren't funded, to where our new fire station's going, and so really getting ourselves informed at all levels.
Great. And then so often public health isn't seen until there's a crisis of need. What avenues and what content do you think would best bring public health into mainstream conversation outside of those times of crisis?
Yeah, I want us to be intentional from the start. So whether you're building a program or you're starting a new research project, what is our public facing outcome going to be? Sometimes we do that after the fact, but not really. And so how can we be forward thinking with this is public health, and this is what we're doing, and it's not just disaster relief, because that's where a lot of people see us. So with the pandemics, with the disaster relief, public health is so much more. Again, public health is life, public health is in all policies. So yeah, how do we make ourselves central? We have to share our message, and each of you are going to think about the different ways that that could be delivered.
Great. And I do have one last question. Can you talk a little more in depth on how to best be heard through an op-ed? Any tips on how to get your opinion in print?
Ooh, and thank you for that gentle reminder. Also, there's a lot of great resources online. So one, there's the Op-Ed Project. They're an organization that helps various folks create op-eds. They give trainings to different organizations, so you're able to bring them in. But they also have a lot of resources on their website too, of giving you guidance on like how to write an op-ed, things you want to keep in mind. Mine are, what's your key message? So kind of thinking about your audience, thinking about accessibility. So my non-public health best friend might read this. Will they be able to understand it? And so really thinking about how do you condense that message down to 500 words. Also, go to your local paper now and start reading their op-eds. So we often practice in class with just reading the ones that are in the Charlotte Observer this week. What are they about? How are they structured? Some are funny, some are more serious in nature. So go and read some and think about kind of what you would like to structure and what you want to see out there. In order to get it published, most websites have a little platform box where you just simply copy from Word and paste in there and submit.
Great. Well, Dr. Alexander, this has been wonderful. I really appreciate your time, as I'm sure the audience does as well. Anything you wanted to close with?
No, just thank you for those reminders. There's a lot of great resources on these various websites. Get in touch with your professional organizations. They also often have policy and advocacy advocates there with the professional organizations. So there are other folks that you can probably go to for this work. Continue to go to trainings. I do myself because there's always new ways and new lenses that we can engage in each one of these methods.
Great. Well, thank you. And thank you, audience, for being here. Remember to head over to deltaomega.org to see previous recordings and sign up for future webinars. Thank you so much.
Thank you again.